Well, we like to set this time aside every week for our friends at the Kansas Policy Institute, and we're now happy to say hello and good morning to the president of the Kansas Policy Institute. James Franko is joining us on KCMO Talk Radio. All right, James, let's just start off with Governor Kelly. I know there's a big push for Medicaid expansion. Where is that conversation at now that we're a couple of months out or so from the legislative body getting back to work?
Yeah, thanks, Pete. I appreciate the chance to be with you again. It's morning again in America, or in Kansas at the very least, in the sense that we wake up and Kelly's talking about expanding Medicaid, but it's essentially dead on arrival in both the House and the Senate in Kansas. We've been doing this now for the better part of a decade, and every time it fails for one reason or another, and it seems like we're just, kind of plowing over the same ground again, if I can mix metaphors here, and knowing what the outcome is going to be, which is it's not going to happen. And it seems like if Kelly really cared about rural hospitals or other folks, she'd be doing other things to try to help them attain a job and then obtain health insurance or what have you, instead of just kind of governing by press release, it seems like.
Well, that brings me to an interesting point there, which is, if it's dead on arrival, then what is the point of continuing to talk about it when there's no legitimate way for this to become policy? Is it about drumming up a base? Is it about voter enthusiasm, kind of like the Biden student loan bailout, which he knew was not going to ever happen? Is it similar to that in some respects?
I mean, it feels that way to me. And it's just disappointing that, again, we can't have kind of a more substantive conversation. And I know talking about politics and substance is, wishing, that I win the lottery or something like that. It just ain't going to happen. But we could be talking about real things that if there's room for, bipartisan compromise or something like that, or even just, getting something done in lots of other ways that could actually help people. But instead, be it student loans or Medicaid expansion or some of these other kinds of things, or the federal budget debates, where the only political party that seemingly cares about fiscal discipline at the federal level is the one that's, not in the White House at any given time. And then everybody finds religion when their side loses. It's a little bit dispiriting because all of these things, I mean, Medicaid expansion, as a continue to the example, is just going to give, my kids and heck their kids more debt. It's not like there's some kitty of cash sitting there that we can access. It's going to be borrowed, and it's going to have to be paid back at some point by future generations. And it's really quite absurd that we're still talking about it.
Now, you want to talk, James Franko, president of the Kansas Policy Institute, about a broken system. Obviously, the health insurance system is the very definition of that. But if people were to say, hey, in Kansas in particular, rural hospitals, we know the struggles they're having. How do we get these folks the help that they need? What is the answer in Kansas?
So I grew up in the Kansas City area. I now live in Wichita. I understand the limitations of my knowledge, let me put it that way, of the challenges that rural Kansas, just like rural, states across this country are facing. But you look at other states, especially when that have expanded Medicaid, rural states, it's not actually saving hospitals. The thing that is causing rural hospitals to close is the same things that is affecting lots of other rural industries. It's mechanization and things like this, macroeconomic trends that are, meaning it takes less people to work the family farm. So those jobs are having to go somewhere. So people are moving to different cities, maybe moving to Dodge or Wichita or Kansas City. So if we're talking about critical access, I mean, if somebody really wanted to do it in this, just to throw more money at the problem, you could, find a line item for whatever that dollar amount is. The state still has staggering sums of excess cash that we should be returning in tax cuts. That's a different conversation. You could do that. You could be making sure in a similar vein that you have critical care, but then that those people can be transferred, to bigger hospitals to get longer term care and things of this nature. But we have to wrestle with the underlying fact that there's just fewer people in rural Kansas, so we need to be providing them the services that they need, but not pretending that something like Medicaid expansion is going to actually do it.
Mm-hmm. Well, this is one of those things, it seems like, James, where it will continue to be used for politics until it stops working, right? I mean, as long as Governor Kelly thinks that there is something positive to get out of this, politically speaking, she will continue to hype up Medicaid expansion, even though she full well knows it's not going anywhere, right?
Right. So, I mean, the proponents of expansion will, propose a bill. It will almost certainly never get a hearing. If it gets a hearing, it will never be worked. And then the folks who are trying to expand it will find a bill that they think is germane, so that means it's related, in the legislature, and they will try to amend the Medicaid expansion bill into some other health policy bill. It could be some other insurance thing or a licensure thing or what have you. And then we'll go through the parliamentary, cogs that we've gone through for the last several years, to where the chair rules it not germane, then we try to override the chair, and everybody knows how everybody's going to vote. So again, it strongly smacks of this is just kind of political posturing for one reason or another. And again, that's going to take time from things that maybe could help rural hospitals.
That's a very good point as well.
But the only thing that we're talking about is Medicaid, not thinking about what the cost is going to do to those rural Kansans who then have to pay debts to expand Medicaid when it hasn't been shown to either keep rural hospitals open or help, ultimately, the people that it's aimed to help.
So true. James Franko, president of the Kansas Policy Institute. James, great work. Thanks so much for being here on KCMO.
We appreciate it. Y'all have a good day.
You as well. Good to have him on.